Hi, Mary. Thank you so much for agreeing to be interviewed, or actually offering to be interviewed for this segment. This is Mary Morrison, and in full disclosure, we're good friends. We went to PT school together, like how many, I don't even want to say, like a long time ago. And Mary helped me with my first courses when I was teaching live courses before the pandemic, doing lab assisting. And actually, she was one of the persons that went through my book before it got published, and gave me professional advice and tips. So we go back a ways, and I'm very happy for you to be here, Mary. And I'm going to just turn it over to you. If you can just kind of like introduce yourself. And
Well, as Deborah said, we're long friends, and for fun, we talk about PT. I know it's pretty sad, but I'm here to say that I did a little bit of orthopedic work, but typically I am a neurological rehabilitation therapist. But that doesn't mean that people don't have pelvic issues. So at the start, when Deborah started this work, I was doing orthopedic, and it was my go-to because I didn't really have a background. And I figured I at least could start the patient out. And if it got beyond my skills, then I would refer them further. But most times, using the book and having good knowledge of anatomy and biomechanics, etc. It's not a cookbook. You still have to use your judgment, but I was able to help a lot of people, and it's been my go-to since. When did you first publish that, Deborah?
that was published, the Sacroiliac Pain book was published in 2018.
But before that, you were
But
doing classes for many years,
my,
and
yeah, my first course was in 2011.
right. And so I haven't abandoned that practice. And in fact, it's still my go-to. So when the physical therapist colleague comes in and says, I hurt my SI, I'm like, okay, lay down. Let's see what we're going to do here. And they get better. My daughter-in-law, she was about 6 months postpartum and could not run. She's a real jock. And she came to me finally, and it was getting worse, not better, with the things she was doing, including resting. And I started her out on the fundamentals, and she is running and running fast, 8-minute miles. And it
Wow.
took less than 2 full weeks to get to be able to run again. So the results are kind of ridiculous, like unbelievable. I expect it to work, but when they do every time, it's amazing. And if they don't, then I have to go back and see, did I assess incorrectly, or maybe it is an SI. But I have done that rule out to start with. But I'm just saying that it is time tested. I know that I haven't done research on it, but it's really been a wonderful tool, this whole approach. So I'm thankful for that.
So, and Mary, that's wonderful. That's and thank you for for helping me get the word out too, because that they've gone through so many therapists, or they just keep on looking for answers. And the doctors have their tool bag, and their tool bag usually has injections. And the latest thing now is fusions, sacroiliac fusions. And so, you're talking about things that are very invasive. And if you can get better with a technique that is, strictly strictly designed around building up your muscle strength and your flexibility, as well as connecting your mind with your body, which is actually another key point, and addressing other wheels within your wellness scope, like eating and getting enough sleep and just addressing the whole person, that would be better than invasive approach, I would think.
I think also that it is an issue to get the word out to the right people.
Mhm.
And another thing that you haven't mentioned in this talk today, or I haven't messaged, is I love if someone's in very acute pain, the quieting and muscle resetting
Mhm.
exercises. And I think that is so helpful. So I think getting it to therapists, who see people acutely, to get started right away so things don't become chronic. And again, of course, the physicians, that's important. And then us, women, word of mouth. Yeah.
Mhm. Mhm. Okay, well, again, I wanted to thank you, Mary, so much. Are there any, I mean, I think you kind of really summed it up very well, honestly. But are there any other passing thoughts, fleeting thoughts?
I think our physical therapy field is going into more standardized approaches. So, if you're a therapist in California or Florida or Ohio, we're going to be more methodical and we're going to get better results. And I think that this approach is one of the factors that keeps us on that road.
Mhm. Great. Okay, well, thank you very much. And I have a parting word that if you are in pain and if you are struggling, keep looking. Try the techniques in my book. In fact, I have both of the books here just to show. This is the pregnancy one that has the pelvic girdle musculoskeletal method in it that Mary was referring to. And then this is the sacroiliac pain one. And again, it's all based on the same method, pelvic girdle musculoskeletal method that I developed, but it's a very basic, really meat and potatoes kind of approach. It's nothing really fancy. It's just really how your body works, and it's based on evidence. So
One more thing, you don't have to be a therapist. This incredible book shows you how to diagnose yourself, and there are alternate ways to treat according to what you yourself learn by putting your own hands on your body. So it's also can be very empowering to a man or a woman.
right. And that being said, if you are working with a therapist or even a chiropractor or a massage therapist or whoever you're going to for your body work, take the book with you because it's a great tool to have with working with another professional. I had interviewed someone on my stories that actually the chiropractor wanted a copy of the book because he was impressed on how much better she got so quickly. So, okay. All right. Well, thank you so much. And thank you all for tuning in, and I'll talk to you soon.